Hello, everyone, and welcome to this introduction video about the peer-to-peer path, which is my plan for the next couple of months or the next 3 months until I make it to my board exam. Let me introduce you to the idea of peer-to-peer path and what's the plan that I'm planning to go through every specialty or every part of the anatomical pathology curriculum for the anatomical pathology boards or the AP board. So at first, of course, I want to thank Dr. Schaberg, the author of Curt Notes, for giving me the honor of using his notes for any educational purposes. This is very generous of him, and that actually is one of the things that that encouraged me to go for it and maybe try to help others like the help that he provided to me throughout all my residency without even seeing him or having him as my mentor. So who am I? I'm a PGY3 resident. I'm a third-year resident in Westchester Medical Center in New York, which is affiliated with the New York Medical College. It's located in Valhalla in Westchester County in New York. My name is Mohammed El Nagdi. For the fellowship, I'm only AP resident, so I'm taking AP only because my future plan, or I'm officially admitted, and I will start July 2024 as a neuropathology fellow in University of Texas, UT Southwestern, in Dallas, in Texas. I'm passionate about medical education. This started since I cleared my USMLE steps. I was involved in USMLE education for 13 years for teaching USMLE Step 1 right now, and around 8 years teaching USMLE Step 2 CK. So for every step I clear, I try to make a series of lectures and deliver what I have in terms of knowledge, even if what I have is not the knowledge at the level of an expert, but whatever I have, I try to deliver in an easy and organized and interesting way for easier memorization and to help everyone else with his exams. So what's peer-to-peer path? So actually in this series of videos that I'm planning to post on the channel, on peer-to-peer path channel on the YouTube, I'm planning to go over all the key facts that's required for the AP boards, guided of course by what we have as a key information in Curt Notes, plus what I added as extra facts and extra information from the QBanks that I've been working on in the past a few months. So anything which is asked, I always highlight, and any extra facts that I'm planning to add is going to be incorporated in the PowerPoint presentations that will be totally guided by Curt Notes. And I will try to reorganize stuff in a way that we can easily memorize and in a way which is more interactive. I will include all the subspecialties. I'm planning to go over all the subspecialties. I'm not an expert in any specialty until now, but I had like 3 years of education or 3 years of training, which are not enough, of course, for pathology. And that's why I called this peer-to-peer, because it's like your colleague, your fellow resident or your fellow colleague explaining the stuff to you in an easy and an organized way, so that it helps you with the study, helps you with memorization, and helps you to have a better approach in terms of dealing with questions. I will include lectures for every part. We will start by weeks. So I will have my first week is going to be GU, so genitourinary. I will start with testicular tumors. We will go over prostate, whatever, kidney, medical kidney. This is the GU, and then I will go from there. Every week we will have a certain subspecialty. The lectures will be concise yet comprehensive, so it won't be like a storm review to the point that you cannot grab anything. So that if a first-year resident is listening to these lectures, he will have his full time to focus and to get an organized approach, not like listening to a pure board review series, which storm the information really quick for someone who already know the basics and already have an idea about the topics. No, we'll go in a concise way, yet comprehensive. We will take our time so that you are able to grasp the information clearly. And of course, we will stick to the information which are commonly asked in the boards, which are actually relevant even in your practice and in your daily signups. So it's going to be beneficial for those who are preparing for the boards and also for those who are developing their basics in pathology from the 0 point. So it's going to be concise, board oriented. And I will include also some virtual slide sessions in which I'll go over virtual slides, because there is part in our board exam which is virtual slides, in which there will be like virtual slide and you go over and you need like to clear some questions based on the diagnosis that you interpret in the virtual slide. So we need to have this approach of how we can approach a slide of a testicular mass, for example, or a lung mass. This is going to be included also in separate videos of virtual slides in each section separately. That's it for this introduction video, and I hope that this is gonna be beneficial for everyone. Please give me your feedbacks for improvement, and I would really appreciate it. Positive feedbacks I appreciate, negative feedbacks I'll try to improve. And thank you very much. Shukran Gaziran in Arabic. This is because I'm originally actually from Egypt, and you can tell from my accent, of course. Thank you very much, and enjoy the videos.